Again, good morning, everyone.
Good morning.
And you can hear us all the way back in the back. Outstanding. Thank you, Nick. Thank you, Ellen. And thanks to all the AIS staff for the work that you have put into making this conference the biggest yet. Nick, I have to say, I've been compared to a lot of things, but never a parking attendant. That is a new one. Well, welcome to all of you to this Aging Summit. And I want to thank you all for coming today. And I know people are still trying to get in here. There's a big lineup still coming in, people driving their cars in. But I'm proud to say that this really has become the go-to event for those of you who care about aging issues. A special thanks to my colleague, Supervisor Greg Cox, who co-hosts this Aging Summit with me. Now, I really enjoyed, particularly this year, planning this event. But I hate to say it, I'm definitely starting to show my age. A few months back, I was talking to my young staff. And in 2005, some of you remember, we had Debbie Reynolds here as a speaker, and I suggested that maybe we have Debbie Reynolds back. And they said to me, Debbie who? Is she on Twitter? Well, anyway, you get it. This summit is a great chance for us to share ideas, learn new things, and I'm sure that each one of you here today have something to contribute. It's also a special opportunity for us to focus on some of the challenges that are facing our families, our communities, our county, like the need to improve conditions and care at some of our assisted living facilities and other elder care homes, like the grueling impact of Alzheimer's disease and other forms of dementia on victims and their caregivers. These are not easy issues, and there are no simple solutions. They can be tough to talk about, but it's important that we do talk about it because they affect so many in San Diego County. These challenges come amid a seismic shift in our population. San Diego County residents are living longer, and by 2030, the number of people who are at least 75 years old is expected to nearly double, outpacing the growth of the rest of our population. This huge shift, this silver tsunami, is starting to test our communities and county government, our homes and hospitals, our public policies, and our personal lives. I'd like to say we're prepared. We are not. A special spotlight is being put today on one of the biggest issues facing many of our oldest San Diegans and their families, and that's Alzheimer's disease. We have an epidemic on our hands. Alzheimer's is now the third leading cause of death in the San Diego region. About 60,000 people, many of them our friends, our neighbors, our loved ones, have this incurable disease, and that number is expected to double in the next 15 years. Women in their 60s are about twice as likely today to develop Alzheimer's than they are to develop breast cancer. So it's time for us all to team up as a region and take on this disease, and we're taking it head on. The Board of Supervisors, at the urging of Supervisor Dave Roberts and myself, recently established the Alzheimer's Project, which is a county-wide initiative to address the impact of this disease and help to step up efforts to find a cure. We're bringing together for the first time local caregivers, health experts, leader of the Alzheimer's Association, and San Diego's world-class researchers and others to craft a strategy to tackle this epidemic. As the region's largest public health agency, the county can and will play a pivotal role in raising awareness and helping caregivers deal with the disease like Alzheimer's. So today's summit is a big part of that effort. We're honored to have speakers like writer Gail Sheehy and San Diego philanthropist Darlene Shiley. Both have cared for loved ones. Both speak from the heart. And I believe both can offer help and hope to caregivers who may feel like they're on a very lonely path. When it comes to researching Alzheimer's, San Diego leads the way, no question about it. No place is doing more to try to unlock the genetic code of Alzheimer's and come up with treatments to slow, or even better, to stop the disease. Many of the world's best and brightest researchers are based right here in San Diego, and their cutting-edge work on Alzheimer's will be the subject of one of the workshops here today. We're also offering sessions on diagnosing Alzheimer's and on memory loss, along with workshops on a wide range of other issues, including financial health and safety. But before we get to those, we have some special speakers, and one of them is very special to me. She is really one of a kind, and she is one of ours. She's a San Diegan. Darlene Shiley is widely known for her charity and her compassion. She and her late husband started donating money years ago. Today, the Shiley name is attached to many of our region's finest institutions, from theaters to health centers to medical centers, including the Shiley Marcos Alzheimer's Disease Research Center at UCSD and the Shiley Brain Research and Treatment Center, an arm of Scripps Clinic and the Scripps Research Institute. No one has done more to support the fight against Alzheimer's, and she has a very personal story to tell about how she joined that fight. Please join me in welcoming Darlene Shiley.